So as part of cognition interpretation in nursing, you're covering the respiratory system this week. And I think it's really important to consider how we understand some of the tests that we maybe do on patients who have a respiratory issue or a metabolic issue. And one of those tests we do is blood gas analysis, arterial or venous. Now I'm talking about arterial blood gases in this little tutorial. And the reason why I'm telling you about it, the way I learned to understand it, was because I found it really, really challenging to understand blood gas analysis when somebody was explaining to me. And some of you will know that I like to keep it simple, I like to keep it clear, and this is the approach that I've taken to understand blood gas analysis. Now, I am not an ICU nurse, I am not a respiratory nurse, so there are parts of this that I am not covering, so I'm trying to keep it really, really simple so that we can determine whether this is a respiratory problem, a metabolic problem, or whether it's an acidosis or an alkalosis. Now, the body does a number of wonderful things when it comes to management of its body. And some of the regulatory systems that it has, the lungs will be responsible for excreting carbon dioxide, which helps maintain the pH of the blood. And the kidneys help with excreting acids and managing acids to also regulate the system. So when we look at blood gas analysis, there are a number of things that are assessed on that results form that you get. But I want to focus on three of them that we've got up here that I think help me understand whether this is a respiratory or a metabolic issue, or whether it's an acidosis or an alkalosis. Now, when you see a blood gas analysis form, you will notice there are a number of things, but there are three things I want you to think about. Number one is the pH. And the pH is, you do it every day when you do a urine dipstick, you check the pH of the urine, you check whether it's acid or alkaline or whether it's normal. And for the blood gases, it's 7.35 to 7.45. Now, anything that goes below 7.435 is considered to be an acid. So it would be acidotic. Anything above 7.45 will be alkalotic. Okay? And when you look at the PCO2, which is the respiratory element, you're looking at 4.6 to 6.0. So 4.6 is considered to be normal, but if it's lower than 4.6, it would be considered to be alkalotic, which is actually the opposite to the pH. And then, of course, the other end of the spectrum is it would be acidotic if it is higher than 6.0. Then the bicarbonate, which is the metabolic element, is 22 to 28. Anything below 22 is considered to be acidotic, and anything above 28 is considered to be alkalotic. So I work in patterns, and I like patterns when I'm looking at things, and I look at these three and think, okay, the three elements that I'm looking at, the top two, the sandwich, so the top two are acid alkali, and the filling of this sandwich is alkali acid. It's just the other way around. So what I'll write on here is the pH equals balance, the PCO2 equals respiratory, and the bicarbonate equals metabolic. Okay, so we'll leave those three up there so we remember those and we cross-reference those, because we will come back to them. So once we've got those figures, that's our normal. And what I would suggest you do, a couple of things, is maybe write this on a card on one side with acid and alkali at either end, and on the back of that I'll get you to draw this thing as well that I'll show you in a second. But one word of caution, when you look up blood gas analysis on the computer, on the internet, you may well find the PCO2, if it's an American site, will reference this as millimeters of mercury, and it won't match with what we have over here. So just be very, very careful that you make sure the numbers do match. So what we end up doing then is on the back of that little card you've created, with this on one side, I want you to draw this on the other. And we all love the game Noughts and Crosses. Played it as kids, we know what we're doing, and we love it. And we're not going to play Noughts and Crosses exactly the same way, but we're going to play it very similarly. You're going to draw out your chart, and you're going to have acidotic on one side, normal in the middle, and alkalotic on the other. And the idea is we want to fill a line, the same way that you do in Noughts and Crosses. And the way we do this is when we get the numbers of our patient, we plug in these things as to where they fit. So our journey will be from our patient with their numbers, determine whether it's normal or abnormal, and then in which case, which abnormality is it, and then place this to complete our chart. So we're going to do that and then that. We'll play this journey. So this to there, is it normal, abnormal? If not, where does it go? And it comes down to here. So we'll start off with the first patient that comes in to see us. They come in and we do blood gas analysis, and we find out they've got a blood gas of pH of 7.4, they've got a PCO2, a respiratory element of 5.0, and they've got a bicarbonate of 23. Now some of you have probably already looked at this and worked this out, but we have to play the game to work out whether this is actually correct. So patient, the pH is 7.4. Let's look at what we know over here. And we see the pH, 7.35 to 7.45. And so 7.4 sits right in the middle. So it is normal. So we put pH in the normal column. We do the same thing for the PCO2. It's 5.0. We compare it to the PCO2 here and see again, it sits right in the middle of normal. So PCO2 has to go there. We do the same thing for the bicarbonate, which is 23. Compare it over here and see that it sits within what is normal. So we haven't got enough columns, so we'll put it there anyway. So we actually have now to fill in our form. And we know we can fill out a line straight the way down there, red pen doesn't work, and realise we have filled in a column. We've filled in our noughts and crosses. So what we know is then this set of numbers that we have determines for us that actually he has normal arterial blood gases. And we've played this game. So we'll do another one. So we have a patient that comes in with a pH of 7.30. They have a PCO2 of 6.2 and they have a HCO3 of 23. So we play the same game again. Patient compared to what is normal, fill in our chart. So 7.3, we compare that to what we have over here, and we notice that it's below 7.35, which is an acid. So we come all the way down here and put pH in the acid column. So we know already this is an acidosis. He's got a PCO2, the respiratory element, of 6.2. We compare that to what we know as normal, and we see that actually it sits outside of normal. And like I said earlier on, it flips around, but this is an acidosis. So we then come all the way around here and put PCO2 in the acidosis column. Now before we finish, we know we've got a line, but we've got to complete this one. And this is the bicarbonate at 23. Come over to what we know is normal, put normal up here actually. And we compare that and realise that it's right in the middle. So actually this is normal. So we come round here and put the bicarb in the normal section. Now we come to diagnosing what's going on with our patient here. So we know we can fill out a line right here. So we completed that. And the way we analyse this, we know it's an acidosis, but we know the PCO2 is respiratory, so it is a respiratory acidosis. But what about the bicarbonate? Because the bicarbonate is normal, the body is not doing anything to regulate this at the moment. It's not doing anything. So it could be this early stages or whatever else, but the bicarbonate is not regulating this. So what that means is, if we're not regulating it, another word we use is compensated. So this is not, because it's normal, it's not compensating for that. It's not making any effort to fix this. So it's actually uncompensated. Now, you will find resources that say partially, fully, uncompensated, compensated. I'm not going to go into that in this detail at the moment. This is purely to say that based on this, we've now worked out he's got a respiratory acidosis, but we know the body isn't doing anything to rectify it. Okay? So we'll do another one. So then we'll have a patient that comes in with a pH of 7.60. They've got a PCO2 of 4.2, and they've got a bicarbonate of 23. So we play the same game again. The pH is 7.6. We compare that to here and realise that it's higher than the 7.45, which makes it an alkaline. So we come all the way around here and we put pH in the alkaline column. So as before, we now know this is an alkalosis of some sort. Don't know what that, but we now know it's an alkalosis. He's got a PCO2 of 4.2. So we come across here to look at the PCO2, the respiratory element, and see that it's less than 4.6. That makes that an alkalosis. So we come round here and put PCO2 in the alkaline column. So we know already, we could draw a line, we know this is an alkalosis, a respiratory alkalosis. But we've still got the bicarbonate to think about. The bicarbonate is 23, so we come across to here, see that it sits right in between both of them, bring it round here, and we put the bicarbonate in there because it is normal. So now we've got to interpret this. So we know it's an alkalosis because we've completed our line in the alkalosis column, and we know that it's a respiratory problem. So this is now a respiratory alkalosis. And as I said before, because the body is not doing anything here to regulate this, it is uncompensated. Okay? So we'll do another one. Right, so the next one will be, he's coming with a pH of 7.30, they've got a PCO2 of 5.0, and they've got a bicarbonate of 21. So again, we play the same game as before. The pH is 7.3, we compare it to what we know is normal, and we see that it's lower than 7.35, which makes it an acid, which comes round to here, and we put pH in the acidosis column. So now we know this is an acidosis of some sort. We take the PCO2, the lung function, the respiratory element. We compare that to what is normal, and we see that it sits right in between what is normal. So we come round here, and we want to put it in the normal column. That's normal, sits in between, normal. So the PCO2 sits in the normal column. Then we want to compare the bicarbonate, which is the bicarbonate HCO3. It's 21. We'll compare that to what we know is normal, and we see that it's below 22, which makes it an acid. So we have to come all around here and put bicarbonate in the acid column. Now we can draw our line because we completed it. So what we know is we now have bicarbonate is acidotic and bicarbonate is metabolic. So it's metabolic acidosis. And because the PCO2 is normal, it's not doing anything to try and fix this. It is uncompensated. We've just played the game to get to a diagnosis of metabolic acidosis uncompensated. We'll do one more for now. So the next patient comes in with a pH of 7.60. They've got a PCO2 of 5.0, and they've got the bicarbonate of 30. So again, we play the game. 7.6, we compare to what is normal, and we see that it is above the 7.45, which makes it an alkaline. We draw our line all the way around here, and it means we have to put pH in the alkaline column. See, 7.6 above 7.45 makes it an alkaline into the alkaline column. We then take the PCO2, the respiratory element, 5.0. We compare that to here, and we see that it sits between 4.6 and 6.0. So we know that it is normal. So we come all the way around here and put PCO2 in the normal column. We then look at the bicarbonate, and the bicarbonate is 30. And 30, we come across what we know as normal, and we see that it is above 28. It's outside of these parameters. And that makes it an alkaline. So we come round onto our chart and put it in the alkaline column. Now what we have to do is interpret what our blood gas tells us. So we know that it's an alkalosis, but we know that the bicarbonate is related to metabolism. So we know it's a metabolic alkalosis. And again, we know the PCO2 is normal, so it's not doing anything to try and fix this. So it's this respiratory side is not compensating. So that again is uncompensated. Let's draw it down there. So I've gone through with you now a normal patient, a patient with respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis, all of which are not compensated by the other. So the respiratory element is not being compensated by the metabolic element, and the metabolic ones are not being compensated by the respiratory element. Now, what I would suggest you do is you go and read up on different types of, probably focusing on the respiratory elements, of how the body is working pathophysiologically with regards to its oxygen demand and oxygen levels and carbon dioxide demand, and whether and how these would relate to that. So that's what I would suggest you do. So this ends this first part of the tutorial. There'll be another one following up on some slightly more complex analyses. So thank you very much for listening.